So first, the case study format. So the big difference between the old NCLEX and the new NCLEX is that they now incorporate this clinical judgment piece, and they test your ability to exercise clinical judgment by giving you these case studies. And each of these case studies is going to be 6 questions long, and each of the 6 steps corresponds to one question, and it's a different step in how a nurse thinks. And you might not be familiar with this, but you've probably seen the nursing process before, your ADPI, and these really closely parallel each other. So first, you're going to be recognizing cues or assessing what's most important, because as a nurse, we always have lots of cues coming at us at one time, and we can't give the same attention to everything. And then analyzing those cues or diagnosing what it could mean. Then kind of our care planning step, where we're prioritizing where we start and then generating solutions for what we can do to address that priority problem. Then finally, taking action and evaluating if it helped. So you guys know how to do this. This is just kind of different language for the same thing. So in every case, in every NCLEX, a minimum length NCLEX, you have 3 full-length case studies. So that means it makes up about 25% of your score. So that is bigger than any of the client need areas for the standalones. This is the part on the NCLEX that you want to be most comfortable with, and that's what we're here to help with. And then if you require longer than a minimum length exam, so longer than those 85 questions, you're going to get additional clinical judgment standalones. So those are going to be your bow tie items and trend items. And we also have plenty of those for you guys to practice with. All right, so thinking like a nurse. The first thing when you actually open a case study is you are going to have lots of data tabs here. And let me show you what I mean. So when you open a case study, you are going to be able to click through your patient's chart, just like in real life, right? You guys might have heard that the NCLEX is vague, and that is true for the standalone items, where you have just a diagnosis, what do you do? So you have only enough information to answer the question, whereas in the case studies, this is a lot more reflective of real life practice, where we've got tons of stuff to look at. And so my best tip for you guys to make sure you don't kind of get overwhelmed by all the details and lose sight of the big picture is to really try and picture and envision that scenario closely. So in a second, we're going to read through this together, and I want you to kind of keep in mind this picture that's forming in front of you, because that's going to help you prioritize things correctly, and prioritization is a big part of the NCLEX. Then we're going to think, what is the priority problem here? And then each time the case updates, so say we move forward a couple questions, then maybe the patient's admitted to the hospital. It's going to tell us up here that we've got a new nurse's note, for example, and then we read that update. Make sure you revisit that every time and update that mental picture if you need to.